Hello there, welcome to ShineTech's YouTube channel, and in this video I'm going to go through multiple choice questions on the gross anatomy of the heart. So the first question reads, the oblique sinus of the pericardium is found A. Superior to the heart, B. Posterior to the right atrium, C. Anterior to the left ventricle, D. Between the aorta and the superior vena cava, E. Between the right and left pulmonary veins. So where is the oblique sinus of the pericardium found? So the pericardium is simply the outermost layer that covers the heart. Okay, so during cardiac looping, the cardiac loops are covered by this fibrous layer, which is called the primordial pericardium or the pericardial sac. And during folding, as the loops fold to form a mature heart, what happens is that as it folds, it forms what we call potential spaces, which are the pericardial sinuses. Okay, so the sinus which is formed on the superior border is called the transverse pericardial sinus, and the one which is formed posterior, somewhere here, posterior on the posterior surface of the heart, is called the oblique pericardial sinus, and that sinus is formed between the pulmonary veins, which are the right and the left pulmonary veins. Okay, so that space is in between the pulmonary veins, somewhere there, where we have the right and the left pulmonary veins. Remember, this is simply a sac which covers the heart, and the heart here has been removed to expose the oblique pericardial sinus. So on our choices here, the oblique sinus of the pericardium is found in between the right and the left pulmonary veins. So the correct answer for question 1 is E. We move on to question 2. Question 2 reads, the base of the heart is formed mainly by the A. Left atrium, B. Right atrium, C. Right auricle, D. Left ventricle, and E. Right ventricle. So the base of the heart is formed mainly by the left atrium. Okay, so in this diagram here we have the borders of the heart. We have the right border, we have the left border, the apex, and we also have the left border this side, and we have the superior border. So the base is just formed by the left atrium there and part of the right atrium together with the vessels which are there. Okay, so mainly it is formed by the left atrium. So the base of the heart is formed mainly by the left atrium. So the correct answer is A. Question 3. The inferolateral part of the left ventricle constitutes the dash of the heart. A. Base, B. Apex, C. Right border, D. Superior border, and E. Inferior surface, posterior surface. So the inferolateral part of the left ventricle constitutes the apex of the heart. So this is the apex of the heart. Okay, now the inferolateral border of the ventricle, left ventricle. So this is the left ventricle here, the left ventricle, it is somewhere here. So the inferior lateral border of it forms the apex. Okay, so that is the left ventricle. Its inferior lateral part forms the apex of the heart. The correct answer here is B. Question 4. To listen to the sounds of the mitral valve, doctor should place the stethoscope at the A. point above the middle of the clavicle, B. medial end of the left second intercostal space, C. medial end of the right second intercostal space, D. left fifth intercostal space at the mid-clavicular line, and E. point just to the left of the lower part of the sternum. So, to listen to the sounds of mitral valve, where should the doctor place the stethoscope? So the stethoscope should be placed at the left fifth intercostal space at the mid-clavicular line. Okay, so here is the intercostal spaces, and we have the heart beneath the sternum in the thorax cavity. So for you to listen to the mitral valve, you have to place the stethoscope into the fifth intercostal space. So we have the first, second, third, fourth, and fifth intercostal space along the middle clavicular line. The middle clavicular line is the line that cuts the clavicle in the middle, somewhere there. So in the fifth intercostal space there, that's where the doctor should place the stethoscope to listen to the mitral valve. So the correct answer here is D. So for the medial end of the left second intercostal space, you will listen to the pulmonary valve, and for the medial end of the right second intercostal space, you will listen to the aortic valve. So the point just to the left of the lower part of the sternum, there you listen to the tricuspid valve. But for the mitral valve, it is in the left fifth intercostal space at the mid-clavicular line. So the correct answer is D. Question 5. Which one of the following arteries supply the apex of the heart? Which one of the following arteries supplies the apex heart? A. SA nodal, B. AV nodal, C. left marginal, D. right marginal, and E. circumflex. Okay, so the one that supplies the apex of the heart is the left marginal artery. Okay, so the coronary arteries which supplies the heart, they are of two types. We have the left, the right, and the left coronary arteries. So the right coronary artery have branches. They have what we call the circumflex branch, which goes to the posterior of the heart. Then we have the anterior interventricular branch, which runs along the interventricular groove, okay, and it supplies the left and right ventricle, okay, as it passes along that groove, and the septum. Then from there we have another branch which is called the left marginal artery. That branch there, it is also the branch of the left coronary artery. It goes to the apex of the heart. Okay, so it is the left marginal artery that supplies the apex of the heart. So the correct answer is C. So we move on to question 6. Which one of the following arteries is the most susceptible to atherosclerotic occlusion. Atherosclerotic occlusion. A. Circumference. B. Left marginal. C. Right marginal. And D. Anterior interventricular. And E. We have the posterior interventricular. So which one among these arteries supplies, or it is the most susceptible to the atherosclerotic occlusion? So the correct answer for question 6 is D. The anterior interventricular artery is the one which is susceptible to occlusion. This artery here, which is the anterior interventricular branch of the left coronary artery, is the most susceptible one. So the correct answer is D. Question 7. The anterior interventricular artery. The anterior descending artery usually supplies the following: A. Most of the right ventricle. B. The SA node in most people. C. The AV node in most of people. And D. The diaphragmatic surface of the ventricle. E. The anterior part of the interventricular septum. So the anterior interventricular artery supplies what? Okay, so let's view it from this diagram here. The anterior interventricular artery, it is this artery here. Okay, so this is the branch of the left coronary artery. So it runs in between the anterior interventricular groove. Okay, so it supplies the septum there, the interventricular septum. 2/3 of the interventricular septum is supplied by the anterior interventricular branch. So the correct answer is the anterior part of the interventricular septum. So the correct answer is E for question 7. So the SA node in the most people, it is supplied by the sinoatrial nodal branch from the right coronary artery. Okay, and the right ventricle is mostly supplied by the right coronary artery by the right marginal branch of the right coronary artery there. Okay, so for the interventricular septum, 2/3 is supplied by the anterior interventricular artery. So question 8. The right coronary artery supplies the interventricular septum via. The right coronary artery supplies the interventricular septum via A. Circumference artery. B. Left marginal artery. C. Sinoatrial nodal artery. D. An anterior interventricular artery. And E. Posterior interventricular artery. So question 8. The right coronary artery supplies the interventricular septum is the posterior interventricular artery. Okay, so this is the right coronary artery. It goes posteriorly and it has this branch here which is called the posterior interventricular branch. Okay, so that one runs into the interventricular groove posterior to in the posterior surface of the heart. Okay, so the correct answer here is E. The posterior interventricular artery is the branch of the right coronary artery that supplies the interventricular septum. That is the interventricular septum posteriorly. So the correct answer is E. Question 9. Which one of the following veins drains directly into the right atrium? A. Great cardiac vein. B. Small cardiac vein. C. Middle cardiac vein. And D. Anterior cardiac vein. E. Oblique vein of the left atrium. Okay, so which one among these veins drain directly into the atrium? So the great cardiac vein is the branch of the coronary sinus, which is the biggest vein of the heart. So it doesn't directly drain into the right atrium there. Okay, the small cardiac veins as well, they drain into the coronary sinus. Then from there, the middle cardiac vein. The middle cardiac vein are the branches there. They also drain into the coronary sinus, but the veins which directly drain into the right atria are the anterior cardiac veins. The anterior cardiac veins, they drain directly into the right atria. So the correct answer is the anterior cardiac vein, which is D. Question 9. Question 10. The parasympathetic innervation of the heart is provided by the A. vagus nerve, B. phrenic nerve, C. lesser splanchnic nerve, D. greater splanchnic nerve, and E. right recurrent laryngeal nerve. So the parasympathetic innervation of the heart is provided by the vagus nerve. So the correct answer is A. Thank you so much for watching. Don't forget to like if you like this video, and please subscribe to this channel so that you don't miss any of my videos, and leave your comment in the comment section below.